So you listed out a few terminologies that I'd like us to delve into a little bit more in terms of distinguishing between burnout versus moral injury. Can you elaborate a little bit and explain your distinctions?
Yeah, over the last couple of years, there's been a bit of a debate of what we should be calling these things, or that it's somehow the exact same issue. And so physicians in general haven't really liked the term burnout because it suggests or implied that you as the individual are burning out because of a personal failure or personal inadequacy. And as I have spent a lot of time following this, researching it, I just don't see that as the failing. A lot of the proponents of the terminology burnout also don't see that as an individual failure. But that doesn't mean that isn't what comes across to those. So that's a little bit where some of the controversy comes in. And a few years back, Wendy Dean and Simon Talbot and others in her network published an article about moral injury. They said that moral injury occurs when we perpetrate, bear witness to, or fail to prevent an act that transgresses our deeply held moral beliefs. And in the healthcare context, that deeply held moral belief is the oath each of us took when embarking on our paths as healthcare providers. Put the needs of the patient first. And that certainly is one of the things that people are experiencing. But burnout is also a well-defined and very highly researched, quote, condition or situation. And it's described as that. That comes a lot from Maslow, and there's a lot others. They kind of collectively looked at a psychological syndrome that was a response to chronic interpersonal stressors on the job, and have all along tried to emphasize the organizational drivers. And it's really when people misrepresent the research that some have applied it in a fashion that it's the individual and that it should be sort of taken out on the individual physician, like you're burning out, so we need to deal with you, instead of you're burning out, what is it in our system or in healthcare that's burning you out?
Yeah, I agree with you. I am not of the belief that burnout is a personal issue. Resiliency, on the other hand, is more personal, in my opinion, than burnout. Hence why I take issue with the word resiliency.
Even resiliency depends on the reader or listener and who's delivering the message. And in a way, I've been conditioned to respond to certain words in a positive or negative way. And I think each of us has a way that we've been conditioned to respond to that, but also from experiences of how it applies. You and I would probably both agree that physicians are incredibly resilient.
Incredibly.
I mean, you don't get to this point unless you're incredibly resilient.
Exactly. For